We've heard about concerns over Chinese drywall and kids' toys tainted with lead paint.
Now at least one local dentist is sounding the alarm over another imported item. News Channel 5's Eric Glasser shows us many people may find this one too close for comfort.
Can you lower her down just a touch for me, too?
Dr. Craig Spodak says he isn't trying to be an alarmist, but the Delray Beach dentist says there is a growing trend in his business that patients must be made aware of.
This is very dangerous in my opinion, and we really don't have any idea of the ramifications, and we won't for many years from now.
The issue, says Dr. Spodak, is that an increasing number of dental implants, bridges, and crowns are being manufactured overseas in countries like China and India for about 1/6 the cost. But with less guarantee of regulation, the imported products have, in rare cases, he says, shown dangerous levels of toxic chemicals. And yet many patients in the U.S. have no idea their dental work is being made elsewhere.
I believe it's your right to know 100% of what's going on, especially if it's going to be in your body.
Dr. Spodak's Delray Beach office is one of the few left in the country where customized lab work is still done on the premises.
We'll see all the bad work you've had done.
That, he says, gives him control over the materials being used. But as many as 20% of dental implants are now manufactured outside the U.S. The FDA and the American Dental Association are both investigating reports that materials used by some of those manufacturers may contain high levels of lead and other dangerous metals.
A lot of these crowns have nickel and beryllium, two caustic and potentially carcinogenic metals, and they're being placed in crowns, and the crowns are going 2 inches from your brain, basically, in your head. So it's a scary proposition.
And I never thought that something put in my mouth by my dentist could actually be harmful to me.
Faye Lewis of Ohio is the patient whose case launched the investigation process in 2008. Shortly after receiving a dental bridge, she got sick. Tests later revealed the product was made in China.
The results were terrifying. They showed elevated levels of 3 toxic metals: cadmium, arsenic, and lead.
Lewis urged lawmakers to take action, and in January 2009, Florida enacted a law requiring dental laboratories to tell dentists where a product is manufactured and what materials are being used. But it's still up to the patient to ask his or her dentist to disclose that information.
You have a right to know. I'd like to know what lab are you using or where it's located.
The FDA says it does not believe imported crowns pose a significant public health risk, and the Florida Dental Association says it's not aware of any incidents in our state. The head of the American Dental Association says he's actually concerned that there's a growing number of these reports on the topic, and that may cause some patients to skip treatment that they really need. The best advice, most agree, is to speak with your dentist and ask them where your dental work is being manufactured. Eric Glasser, WPTV News Channel 5.
Great advice. Thank you, Eric.